Hey, Dr. Lindsey and Wendy here. We're going to take you through a short scar facelift or mini facelift on a very attractive 60-year-old blonde lady who had a procedure by me, I don't know, a number of years ago. And so when we talk about facelifts, there's a number of types you can do. Back in the 70s, people really figured out that just pulling the skin doesn't do much. And then there was a study by Mitz and Peroni, which is really the landmark study, so you really need to pull at least the muscles that support your neck. And that's the standard SMAS, S-M-A-S, facelift, and that's all I offer. And then there are deep plane facelifts, which I don't offer. And I don't offer them because oftentimes I find them not necessary, and I personally find the risk to the facial nerve, or nerves that work your face, unacceptable for my level of comfort, and generally for our patients' level of comfort. So this attractive lady came in a number of years ago, and she looked like this. And we did this short scar procedure on her, and at a week she looked really quite good. And I haven't heard hide in her hair of her until recently, and then she came in and did this short pre-op interview. Hey, I'm here with Jennifer. And Jennifer, how old are you?
30 times 2.
Okay, well, you look good, and you are perfect for a little tune-up. In fact, we did one a few years ago, and your before pictures were up between us, and we did a short scar facelift and a little bit of liposuction, and then you wore a head wrap for a week, and then I got your stitches out, and I haven't seen you for a few years, and so you just want a little tune-up. And what this little procedure does best is not a complete makeover, but make you look refreshed. And so when I look at you, without giving any compliments, I don't think you look 60. I think you look maybe 52 or so.
Times 2.
But I think we can get you down 5 or 6 more years, and it should be done. We're doing it in a local today. It's not going to hurt when we do it. It's going to be sore tonight, as you probably remember, and then that's about it. And then we'll take your stitches out next week, and maybe we'll do a follow-up video in about a month. If not, I'll show you. I'll edit the video and put your pictures up. It's okay to use your pictures and everything on the internet.
That's fine. Okay.
Any complaints or any advice you want to give to people since we've worked together before?
No, you're an excellent doctor. I didn't have any scarring. The recovery was quick, and I have nothing but great things to say about you, doctor.
All right, thank you. So then after that, we did a short scar facelift on her, and she went home, and here she is at day 6, yeah, and another short little interview. So today's day 5 out from your short scar facelift, right? Mm-hmm. And you wore your wrap all weekend. You were supposed to wear it today, and you came in without it on, so I complained to you.
You did.
As all bankers do what they're going to do. And you look good. Your before pictures are now up between us. How bad was this whole week? You can be honest.
It was okay, actually. I took some time off work, and no one saw me, so it's fine.
And so as we were just talking, you look a little too good today because your skin's still a little stretched. Your final results like 11 days from now, day 17. And hopefully we get you back at the end of May and take 6-8 week pictures.
Okay, you can count on it.
Right. Thank you a lot. So in summary, she's had 2 of these procedures separated by several years. And we've been doing this together for 21 years, and I've been doing it for another 7 or 8 years before I met Wendy. And so, yeah, we do have a number of women who come every 5 to 7 to 10 years with this. And I've seen people that are perfectionists, and they want to be pulled every 3 months, but that's not realistic. And I've seen people that are maybe a little long before they get it done, but I'd say on average it's 6 years.
Yeah, 6
like
to 7.
Yeah. And so hopefully we'll get her back in a few weeks and get a follow-up interview. She's a real busy executive, and I'm not sure we're going to see her anytime soon. But
whenever she's 6-7 years.
But in summary, we do these under local anesthesia with some light sedation with Valium. We can do them at the surgery center. That certainly takes away the numbing pain, but it adds some risk with anesthesia and some cost.
And downtime. That's what they always ask me. You did mine. You did a mini, a smaller one when I turned 40.
Yep.
I'm 49 now, waiting for 1 more year to get another one done. And I think you said I didn't need it as much, but what I have seen is it just holds it longer.
Yeah,
I see people aging.
I think we've had a bunch of women here in McLean do this, and they don't tell their friends, and what happens is you see them and their friends out 2 or 3 years later, and the patient doesn't look perfect, but they look more rested than their peers who look the same. They just aged slower.
Yeah, that's what I noticed with my friends. Everybody keeps on aging, and I feel like, yes, I have aged, but it still holds in. Those, and I tell people it's 1 week downtime. It's not, it doesn't break the bank. It's not super, super, super expensive. A lot of people are afraid when you talk about surgery is, how much is it? Because that's the number one question.
Right.
And when you tell them the price, they're like, oh, because it's done under local, so it cuts down.
And I think you're spending X dollars for 25 or 30% change with resurfacing, or X the same dollars for 50 or 60% change. Maybe for some people that's a better value.
I like surgery. I like a mini lift. And there's people that need more than, I think I'm a candidate for either one, but I'd rather have a bigger change than have, and there's older people that need a little bit more excess skin removed. Lasers do not remove excess skin.
Right. So we've done these on people in their late 30s, and we've done people in their early 80s. And so some people might say, well, did a 30-year-old need it? Well, nobody needs anything, but did the person achieve a benefit that they wanted from it? And the answer is yes. And somebody might say, well, the 80-year-old might need a huge makeover. A lot of people don't want a huge makeover. They don't want everybody to know they had it done. They don't want to look like the people that you see on the magazines at the checkout line at the grocery store. They just want to look refreshed. And if that's something that you're interested in, give us a call and we'll be glad to talk to you. Thank you.